currently for myelofibrosis, there are no drugs approved outside of frontline setting. Frontline setting, we have ruxolitinib and fedratinib. Those are both JAK1/2 inhibitors. So after there's resistance with JAK1/2 inhibition, we don't have any drugs available for these patients, and often there's disease progression that's a natural history. So what we're looking for are drugs that can overcome resistance in the setting, and there's strong preclinical rationale using the BCL-XL inhibitor navitoclax. This was a phase 2 clinical trial testing the addition of navitoclax to patients on standing ruxolitinib. Patients that came on study had to be on prolonged ruxolitinib exposure for a minimum of 12 weeks. And what we were able to find is the median prior ruxolitinib time was essentially 21 months, suggesting that patients were heavily pretreated. Patients that came on study had to be on a stable dose of ruxolitinib of at least 10 milligrams twice a day for 8 weeks. So we know what their side effects are from ruxolitinib versus newer drugs, and we wanted to make sure that patients did get their best response on ruxolitinib before coming on study. When navitoclax was added on, it was assessed on a weekly basis. Patients would take daily navitoclax at a low dose of 50 milligrams and slowly dose ramped up to 300 milligrams daily if they could tolerate it based on tolerability and platelet level. The primary endpoint of the study was looking for splenic volume reduction, or SVR35, at week 24 compared to baseline. And secondary endpoints also include looking at a total symptom score, benefit or reduction, and also looking at bone marrow fibrosis reduction.